Welcome to the Banega Swasth India podcast. Our focus is on creating a holistic and healthy India for each and everyone. Our goal is one world hygiene, where citizens, individuals, society, and governments work together to ensure health for all and foster global unity for a healthier tomorrow. I'm Arun Singh, and today we have with us Dr. NK Ganguly, former Director General, Indian Council of Medical Research, that's ICMR, to discuss India's status in eradicating NTDs, that's neglected tropical diseases, and bringing some of the diseases to the elimination stage. Thank you, Doctor, for joining us. Let me start by asking you, what is the present status of neglected tropical diseases in India?
NTDs, total susceptible population in India is about 700 million. And 1.7 billion worldwide are affected. In India, out of the 20 NTDs, about 11 to 12 are prevalent over here. And top 3 NTDs will be the Leishmaniasis, the filariasis, the leprosy, and at the moment we also have in our program the Leishmaniasis is also known as Kala Azar in colloquial term. And another major program which we are undertaking is the elimination of soil transmitted helminthic disease. So these are some of the top infections here.
Doctor, how does climate change influence the spread of NTDs?
One of the major factors in the climate change is the increase in the temperature. As the temperature increases, based on the vegetation as well as the rainfall and temperature, the vector density increases and the vectors are able to fly more than 1,000 feet above what they were there. So this is the major cause. And if the water accumulation happens because of flooding as well as the rapid urbanization, the mosquitoes get a breeding site to breed.
Okay. Doctor, what is India's progress so far in tackling neglected tropical diseases?
Actually, India was very successful in a sense that we eliminated the guinea worm, that dracunculosis, in 2000. We got leprosy away as a major public health problem in 2005. In 2017, we almost declared the trachoma, infective trachoma. We almost made it elimination, took it up to elimination stage. It's not eliminated, but is no longer a public health threat. And at this given moment, out of all the endemic districts, 90% we have eliminated, we have removed Kala Azar as a threat. That is, it is less than 1 per 10,000. And at this given moment, only 6 districts, 4 in Jharkhand and 2 in Bihar, are affected. So there's a huge progress which we have got. And in the filariasis, which is also one of the major NTDs, about 133 districts we have stopped the mass drug administration.
Well, that's a great achievement we have made so far. But doctor, how can we mitigate most of the neglected tropical diseases from India?
We need to have an integrated approach for vector control, because for each vector we cannot design a separate control measure. So this is one of the things which is now in the anvil. The second one is that identifying drugs which will eliminate the carriers, those who carry the drug and carry the bug and transmit it. How do we reach them the drug, whether for preventive drug or a curative drug? That is one major thing which has happened. And for many of these, we have now drugs. We have drugs for Kala Azar, that is the liposomal amphotericin B. It was previously being donated by Gilead and WHO. Now India is making it. The same way for the drugs for the filariasis are also made in India now. And they are all available at this government. Problem is that how to reach it to everyone who needs it and diagnose them very early, so that we can take them and find out diagnostic tests which will tell us that whether we have been able to cure these guys or not so that they don't transmit it in future. Finally, there is one more very major area, that is the mass communication. These are all mass campaign programs. So if we really want to reach people, it is very difficult if we don't have a mass communication program and partnerships and also an appropriate financing.
Banega Swasth India podcast will be back after a short break.
Watch out for a new Banega Swasth India video podcast, Swasthya Mantra, the first ever public health and hygiene podcast. The podcast is live on Spotify, Apple, and YouTube in English and in Hindi.
Welcome back to Banega Swasth India podcast. Now, Doctor, let us shed some light on leprosy, which was removed as a public threat in 2005. Still, leprosy is a burden in India. Where is the gap?
Actually, why it is burden in India is this, that there are patches of area in India where it was not eliminated. And this is again a disease of the very, very poor now. They live in the ghettos, they live in close proximation, and this has a very large incubation period. So, those guys who were infected maybe 10 years before, they can still transmit it. And if they are living in a close conjunction, there's a contact. This happens through the contact. And there is another major reason, that the kind of leprosy which occurs has changed. Previously, it was a macular papulation which was disfigurement, and that was really noticed. Now it is a simple color patch, and nobody really notices it and nobody bothers about it. But they are able to transmit it. It can be transmitted even by the nasal drops. So that is the reason that it is happening. As we are eliminating poverty and as we are reaching these guys, and we have again in between what happened, that we have stopped the active surveillance and many of the leprosy labs got closed. Now we are revising it. We are again training the dermatologists and others to diagnose leprosy and these patches.
Now, Dr. Ganguly, what are some of the recent breakthroughs in the treatment and elimination strategies for neglected tropical diseases?
One of the major breakthroughs for the leishmaniasis was the combo drug. So if there was a resistance to liposomal amphotericin B, and in some of the countries it doesn't work, like in Africa, the amphotericin B doesn't work. So there were combo drugs like miltefosine and amphotericin B. So this is a very big breakthrough, and this is now available. In the area of filariasis, the breakthrough has been for the accelerated elimination, adding another drug. Previously, we were using diethyl carbamazine and albendazole. But now, in some of the cases where you have given several multi-drug administration and they have not responded, we are now adding ivermectin. This is the accelerated elimination, and this almost eliminates effectively the adult worms also, which were not eliminated by the previous efforts. The third one, in the leprosy, we have now minocycline as well as clindamycin, which has been added as an additional drug where they are not responding. So these are some of the new developments which have occurred in the treatment front.
Doctor, what is a vaccine scenario in India to prevent the neglected tropical diseases?
One of the major vaccine which might be soon available is for the Kala Azar. And luckily an Indian company is making this vaccine, which has been discovered by Dr. Hiranakasi from the US FDA, with the funding from the Indian government also, Department of Biotechnology. This particular vaccine is a live vaccine but attenuated vaccine. This has been tested in Tunisia, And it has got one very major advantage. It will prevent Kala Azar, as well as it will prevent tropical leishmaniasis, which is prevalent in northern India. Another very exciting vaccine scenario is happening for the dengue. And the NIH vaccine, which is also known as Butantan vaccine, has been transferred to 3 Indian companies: Panacea Biotech, Biological E, as well as the Serum Institute of India. It is in advanced stage of preparation and will be in the market in another 1 to 2 years. So we will have a vaccine against dengue, which is one of the major threat really in the NTD family, because 92,400 cases has happened up to September of 2023.
Finally, this brings me to my last question. How can we eradicate these diseases and promote global health equity?
We need to have increase the financial part of it. It also need to get into the SDGs, Sustainable Development Program, where a lot of other things like water, nutrition, child and women, because it affects the women and children most, the child and women health groups, as well as it need to be integrated into the health systems. One more challenge is the water sanitation and hygiene, because wherever there is a gap in hygiene, the dengue surges. So all of these gaps are very difficult to surmount, and we need to go for that. We really need to strengthen the surveillance, active surveillance, don't really loosen it. We should be able to use GIS and the new tools with which we could find out even the major hotspots of the vector density and coming up. Finally, we need to engage communities. So the NGOs need to be very strongly engaged for an indefinite period of time, even after the elimination. And it should be integrated into the health systems, because it cannot be sustained in the program mode forever. So the health system integration is very, very important, so that the health system is able to take care of it. And wherever there are morbidities like hydrocele, which happens in filariasis, or elephantiasis, which happens in filariasis, this should be able to be taken care by our health system.
Well, that was an insightful session. Thank you, Dr. Ganguly. That's it on the Banega Swasth India podcast this week. If you have comments, queries, or suggestions on the topic we discussed today, or issues you would like us to cover in future, write to us on bsipodcast@ndtv.com. Remember, BSI stands for Banega Swasth India. You can also connect with us on Banega Swasth India handles on Facebook, Twitter, and Instagram, and continue the conversation through the week. Till next week, this is Arun Singh signing off. Stay healthy, stay safe.